that we are a couple of steps to getting people to properly wearing the mask. Couple of weeks back, you couldn't have anybody to even consider taking a mask in their hands. Even I'm bringing it back to the petty traders that will always take life for granted. The young boys that do commercial transportation, we call them the pimping boys. They are all having the masks on. They might not be properly masked on. Some are properly masked on, but they are attempting to. So again, CSO also helped to amend government effort. Government is doing the best. I must say that the first and second wave, we felt that we were COVID champion and we were putting our shoulder up that we did a lot. We saw effort of multi-sector approach to the respond. There were effort, but they were wearing that we expected. But we saw the willpower, and Liberia was doing amazingly well. However, we are here, tail wave, with an imported dirty tap of the COVID virus. At first, and I can say I just had a conversation with somebody, everybody felt that because we were able to, as Faith readily said, that we allow our guards down so early, we were able to handle wave 1 and 2. Even for the second wave, I'm still talking to people that I didn't even notice it, because in no time we were able to put mechanism in place and were able to prevent the spread. So when we started to hear that we had a tail wave, a lot of people took it for granted. A lot of people felt that, oh, it's just the same thing. We were still not wearing our masks. We were still into public gathering. Even we that are placed there at the health sector of the NGO, we will see the data and we'll be like, oh, tail wave, it will be fine. But no, we started to lose our friends. We started to see permanent people in society scrambling to COVID. And that reality have actually sunk in a sort of way that people are now so worried. There is a fragile situation that everybody have panicked. We are panicked, but I feel that Liberians are resilient. We are going to pass there because we are going to build on what we have done before, use the community-based approach to prevent the spread. And I think that's the only way. People need to stay protected. Community people need to start their community policing, stopping people from entering the community, minimizing mobilization, have a robust monitoring of what is happening within the community and reporting. I think the community approach will actually help to minimize the already stretched health system that we have. Even malaria will weigh our health system, maternal health care will weigh our health system. Not having an infectious disease that is already weighing our health system. We don't even want to even think about Liberia. Like if it's something you just want to put out in our framework that what's going to happen in 2 months if we continue like this. No, I think Liberians are resilient and we're going to really fight this, and it can only happen once we decide to ensure that there is collective effort and ensuring that all hands are on deck. Everybody, every sector, the police, the marketeer, the people at the community level, the CSO, the INGOs, the government, the young people within the community, the religious leaders, the traditional leaders, influential people. We need all hands on deck to actually stop. We need to stop the infectious rate. We are at 80% infection rate currently. No, we can't be. And listen to the figure. We're talking about people had died over 1,000 Liberia. Within a year, we will stay at 90 under 1,000. Within 2 months or 3 months, we are at 1,400 plus. We maintain our death rate at 85 or 80%. Now we have exceeded with 127, 128, and we are claiming no. Why? So there's a lot of statistics to think about. There's a lot of approach to actually consider, come around the table and brainstorm and ensure that no one is left behind, and ensure that there is a collective multi-sectoral approach to this virus.
Abby, you're a provider. Listening to the news coming from Monrovia, what does that tell you?
From what I'm hearing from these two ladies, they seem to have everything under control right now, or not everything under control, but they seem to be controlling it to the best of the ability. But I practice only in America, in a developed country, and I know for a fact from my family and friends back there that most of the technologies, the equipment, and everything else that they need to fight this virus for people who, when they go into the hospital, it is, they don't have it there, or it's not readily available. It's not in a vast amount that you can really say, I can, help fight this disease effectively with at least 80% of the population. Because I just spent 22 years in acute care working on telemetry floor, stepped on ICU, and we were in the midst of all of this last year. And we saw how people came in, and I see on Facebook and I see other things where people are donating oxygen tanks, and maybe 10, 12 here and there. When you think about how much oxygen one person needs, I'm not even talking about those who are on the vent. We have people who are on nasal cannons, like the little thing that goes right in your nose. You can go in and you can be anywhere from like 2 liters. So it's people who are in mid-flow where they like 10, 12 liters at a time, and they need additional thing, IV therapy, IV antibiotics, IV fluids. You had your physical therapist, you had occupational therapist, speech therapists, the nurses, infectious disease, pulmonologists, all those, the multidisciplinary team that is required to effectively control this virus and also help, I don't want to get too scientific here, but to really help the people who are in the hospital and those who are in the community as well. That is not there. So I don't understand when you're saying, and I know you guys are not like specifically in the health field, when you're saying that this is, we got this, we had it the first time around, we had it the second time around, and how you guys really handling that when you really need all of this to control this, to really combat this virus. How are you guys doing all that with with so little equipment and so little manpower, and so little, like none of the specialists and all that, or barely none of the specialists around? How are you guys doing that? I know you can do things from outside of the country and NGOs and things like that, but in my hospital alone, I worked in the community hospitals. We had like a whole team of infectious disease doctors and specialists and all of that. And you're talking about Liberia that barely has any of that. How are you guys working along with that? I don't want to question. I don't want to take your place past the patients. Like just trying to.
No, that's very important. You can come in.
Part of the question that I want to ask right now. She says something which Naomi buttress, and that bring me to another question. She said we let down our guy. I want to know what it means. Did it mean the government were not properly prepared to continue the testing, continue the advocacy, continue the awareness? We want to know who let down the guy. Is it the government let down the guy, or is it the people that let down the guy? If we were doing the proper thing, if the different ministries and agencies and CSO, if they were all doing the right thing, what happened to the rest of the people? Do you think that they would have let down the guy? I mean, I'm trying to figure this out, trying to understand this whole thing.
Yeah, Madam Patience, I think you bring up a good point, and let me clarify that, because I said we let down our guards, and we absolutely did. And when you think of, I can specifically speak about me, and that has been in pandemic preparedness. My background is disaster response, pandemic preparedness for years. And what I can say is that it takes a whole of society approach. And Naomi hinted to that, a multi-sectoral approach to respond to any kind of disaster. It's not just the government. It's not just the INGO. We have to take responsibility as individual citizens. So you could say the same for the United States. I mean, nowadays you hear people are not wearing masks. Obviously, yes, a good portion of the US has been vaccinated, and we'll get to that part in terms of discussion around vaccine. But generally, there has been a global COVID fatigue. We've been fighting COVID for over a year. And because we did relatively well in wave 1 and wave 2, and one of the reasons why I can say we did relatively well, and I'll come back to you, Abigail, those major supply chain needs for hospitals are not there. So there's no argument around it. The basics, when you talk about a fragile health system Liberia has one of the most fragile health systems in the region and perhaps on the continent. Some of the basic needs are not there. But the reality is that the first and second wave, keep in mind, we were fighting a different beast than we are fighting now. That brings me into the conversation that Liberia is dealing with the Alpha variant, which is the UK variant. We know that the Delta variant is permeating the continent. Take, for example, 97% of the cases in Uganda have been attributed to the Delta variant. 74% of the cases in the Democratic Republic of Congo, the Delta variant. Unfortunately, Liberia does not have the capacity to test for the Delta variant. We sent samples to Ghana and it came back as Alpha variant. But what we can suspect just by process of elimination is that there's a high probability that the Delta variant, which India was fighting, could possibly be in Liberia. So we are fighting a more severe variant, or we are fighting more severe variants than we were in wave 1 and 2. People are sicker, they're dying quicker, they have more severe chronic illnesses. So take, for example, during wave 1 and 2, there was never a time we have more than 20 critical patients. As it stands in the treatment facility, there are over 38 critical patients. So I'm not sugarcoating by saying Liberia is doing everything well. What I'm saying is that in terms of the response to phase 1 and phase 2 or wave 1 and 2, Liberia did relatively okay because we didn't see the high numbers. Now we're fighting something completely different. So you're seeing higher numbers. You're seeing the need for therapeutics that Abigail mentioned we don't even have. We're having to rely on international partners to come in and provide the level of support. So yes, Liberia is not there yet in terms of the quality, and the fragility of the health system makes it even harder. A few weeks ago, we were out of oxygen. We've had oxygen donated and we still need more. We need other therapies. We need other support. So we're not definitely there. But what I can say is collectively, and coming back to you patients who let their guards down, all of us, every single one of us, I think we got comfortable. We stopped wearing masks the way we needed to. So now with the alert, the level of deaths, you're seeing people being more responsive.
Yeah, thank you. And Naomi, before you come in, I just want to see, because I'm watching from afar, right? I'm watching TV, I really did not see, to be honest, what was put in place for the first and second wave. Right. So when they say, like we were prepared or we did this better, from afar, we didn't see it. We still saw people congregating. We saw political rallies. We saw people in each other's faces. So I don't know at what point and what we did really, what did we do as a people for the first and second wave that we've not been able to. So when you say we let our guard down, I'm thinking the guard was not even there. You know what I mean?
And I don't mean to interrupt. The first, when you're saying the first and second wave, it didn't seem like it was the first or second wave. I probably was more like a hiccup than a wave, because when you compare the population ratio of people that was sick to that. So, I mean, and right now you say, okay, you're effectively handled the first and second wave. So the first time around when people were sick, do you have, so, and between the time then and now, did you buy your X-ray machines, CAT scan machines, MRIs? Did you train more people where you're in the process of training because you're in pandemic preparedness and all that, where you're getting more people and doing seminars and webinars to get people ready in the eventuality that something else would have happened, where you're looking forward to, where you're looking and saying, okay, things are going on around the world and it's slowly coming towards our way. It may or may not come. What have we done? Okay, equipment wise, you have the distant, first and second wave. Yes, we're lucky, but usually when things calm down is when you start making sure you're getting all these, like, for example, I don't mean to
Preparedness.
Or for example, when I was in the hospital, okay, I was a patient at one time. I was an inpatient, but when I started having chest pain, because that one of the symptoms of COVID and all, I started having chest pain. I went to the hospital. I'm talking as a patient, not as a nurse. in the emergency room and all that. Okay, they said that they do the EKG. You have EKG machines there. How many EKG machines for each person? You have EKG text. You have people to read it. Okay, they did that. They say, okay, your rhythms look okay. You can sit down for a little bit and rest. I was in the place that were about, maybe 30 people, family members couldn't come in, and I went in there. They did my blood work and all that. Do you guys have phlebotomists? Enough phlebotomists, inpatient labs and all that? Okay, they did it. Say, okay, your D-dimer looks a little elevated. That's one of the testing that they do to make sure you don't have any blood clots in your lungs. One of the main reasons why most COVID patients die too, because they have all these little blood clots that eventually kind of clot together and then they die from that. So, okay, they say, all right. I'm like, okay, so let's go do a CAT scan, because that's the most definitive test to do CAT scan. You can't just say, I'll look at you. Do you have CAT scan there? You have to be done with it at a certain amount of time in order for other person to go into it. And it has to be done very quickly, because you could be sitting right there 1 minute and deteriorating the next minute. You guys have that. And the radiologist who's going to read the CAT scan machine, all of that. So when you were getting ready for the first, was that present in the first wave and the second wave? And is it not present now? Letting down your guard is just saying like, oh yeah, we let down our guard. Yes, everybody's tired. Trust me, I'm tired. I still have to wear masks because I see patients in the office right now. But those are major things. Those are necessities that should be there. So anytime you're letting down your guard, where all these things being prepared, not only just for COVID, but for any other time.
Yeah, Abigail.
I think Naomi wanted to come in.
Yeah.
Hold on. Let Naomi can go ahead now.
Okay, so a group that Abigail is speaking as a nurse that is in an established system, a country where system work. You are talking to Liberia, Abigail, not only for COVID. One, if a patient happen to access CAT scan in Liberia, that's a luxury. That's not a healthcare. That's a luxury. We attach that to being rich. We attach that to economic status. That's not a right. That's not a health right in Liberia, and not even because of COVID. So now, what we are saying, if you listen to me earlier, that our health system was already scratched just from the three the diseases we call mad diseases: malaria, tuberculosis, and HIV. These are the three alarming cases in Liberia. Our health system is already scratched. If you put maternal mortality there and infant morbidity, that's another issue that you're going to discuss for another day. Then here comes COVID. COVID is not like Ebola that was only in our region. COVID is a global pandemic. When you hear us say that our first and second wave we did right, don't get me wrong. Liberia was one of the first countries that started to ensure that we had check-in at our airport, and people was being checked as they entered even before America. Because I left America March 16 and nobody tested me. I left New York. Nobody tested me. And I came here, I was laughing and like, oh, I was one of those who was saying, yeah, COVID, I'm from New York. I entered Liberia 2 days after in the shutdown New York. So we all felt that we didn't take this serious. And with all of the alarming cases that were happening in all the advanced countries, look at Italy, look at France, look at Europe, look at America. Everything that was happening in Liberia was still having our stuff together. If we didn't do it right, whatever we did work for us. If the citizens decided that they were washing their hands more often, maybe they were steaming themselves because that's the common thing in our community. Maybe they were using the hot tea. It worked for us, the first and second wave. Nothing medical actually really worked, but it was that visible action from people in the Vera community. Now, this third wave, this strain of virus is strange.
Stronger.
You see somebody healthy today, they're talking to you on the phone, and tomorrow they're in cardiac arrest. They're going straight in respiratory distress and looking at having access to oxygen where you have to ration the oxygen with treatment center. So you see that a lot of people beginning to die. So when we say we allow our guards down, what we had in place, maybe we felt was in place, wasn't working. Now there is an actual reality that what we had in place needs to be strengthened. Okay. So a lot needs to be done. We recognize that the gap is huge. But what we are saying is that nurses, doctors, physician assistants, the cleaners, they all work tirelessly day and night for the first and second wave. They are still working with limited or lack of no resources to help to save lives. and we shouldn't leave that unnoticed. Yeah, with the
That's
government system, the lack of leadership, these are something that we can talk on later on. But we don't want to dwell on lack of leadership. What we want to do right now is to ensure that people are getting the right information so they too can know this is serious, so we can stop the spread of this virus, because that's all we can do for ourselves.
Thank you, Naomi. Before you come in, thank you, Naomi. Before you come in, Dennis, we want to acknowledge the tireless healthcare workers in Liberia. They are doing extremely well with the little resources they have. And we understand the fragile health system. That is something we all recognize. Whether you are in Liberia or you are out of Liberia, we know that it as a fact. So having said that, I'm in constant communication with my people in Liberia. And one of the things that I believe, is part of the problem that is increasing this, this whole spread and the virus is, I'm coming back to Naomi, not Naomi, but Abigail, to tell us there's a thin line between the symptoms of malaria and the symptoms of COVID. Because most of the time they'll tell you they have malaria. Meanwhile, that's the beginning of the COVID symptoms. And I was talking with someone in Liberia. I said, we need another thing, CSO. Another thing maybe we need to start asking our partners for is thermometer. So every home can have a thermometer in a place. I'm telling you, it is serious. Because people running them at 100 plus, and they just think it's malaria. So coming back to you, Abigail, we need to know the difference. People are washing. We want you to draw a line. These are the symptoms of malaria. So these are the symptoms of COVID. So when you see these things happening, what are the steps they ought to take?
Well, both of them, well, COVID is more respiratory, but both of them are having an inflammatory response. Meaning, so when you start having their symptoms are so almost like the very thin line, like you said, that. But with COVID, some malaria, I haven't had malaria, and don't take care of too many malaria patients either. So it's not, on this side that much. But when you start having COVID, most people, like, it's unique to everybody too. So I can say some people will have, you feeling fatigue, you feel like, you can't sleep, or you're very lethargic, meaning you're very sleepy. You start having shortness of breath. You start having cough. Some people have abdominal pain. Some people have diarrhea. Chest pain, again, like I said, shortness of breath, and sometimes you have none of those. And even when you're having malaria, mostly the time you start having fever as well. But sometimes COVID is the symptoms can become so fast, so quickly. I think malaria runs a little slower than that. Like I said, I haven't treated any malaria patients before. But like I said, they both have inflammatory response. And because in Liberia, you don't have all the different testing material there to really differentiate both of them quickly, I would say if you have malaria, if you have any symptoms of malaria, it will be best in the Liberian setting to go to the hospital, get tested, and get treated. And so they can do the testing there and say, okay, this is what you have. You have malaria, we treat you for malaria. And if you have COVID, we treat you for COVID. But again, going back to the fact that you don't have too many things there. So yeah, go to the hospital. You don't want to take the chance, because usually when my patients call me, I have to, when they call and say, okay, can I speak to the provider? I have to okay them. I have to certify for them to get tested for COVID, because now it's like insurance and all that. So they have to tell me all the symptoms. I have to listen to when the last time they were among anybody that they were in a far group of people, if they were in a hospital setting or anywhere that they may have been exposed to a lot of group of people, or there was somebody else was sick in the house, or somebody else has symptoms. When I listen to all that, I say, okay, yes, you meet the criteria to get tested. You can come to the office and get tested. We have a whole different way of doing it, or go to the hospital if you have any symptoms. Even if I do tell them, okay, you don't meet the criteria, or you meet the criteria to come in, I also say follow up, make sure you still continuing with your COVID, the CDC guidelines, wash your hands as often, try to stay away from people. If you feel you're getting short of breath, if you feel you're sleepy all the time, make sure you go to the emergency room, because like I said, you can go from feeling very fine to getting to be, needing to be in oxygen in within a period of 10 minutes or so, or to an hour. But in Liberia, where you don't have immediate testing, preliminary testing to know the difference, go to the hospital. And that would be my thing, because they both have inflammatory response, and or that people are taking hydroxychloroquine. You want to make sure you get to the hospital so you can get that if you have malaria, and if there anything else that comes along with malaria, like if you short of breath and everything, lethargy and everything that comes along with it, you get the fever and give you everything that you need to take to get better. Yeah, you should tell people, even if they say I'm coughing too much in America, I'm coughing too much, but I don't think it's COVID, and I'm sick a little bit here and there. I say come and get tested, because you never know. You never know. So if you suffer from malaria, or you in a place where Liberia high risk of malaria, go to the hospital. But the emergency room there, you have to get tested. Most of our patients, when we tested them right outside. We had a whole little tent outside when I worked in the hospital. They got tested before they came into the hospital itself. So you're not exposing everybody else to what you have. So I can only talk within the realm of what I know.
Thank you. Ladies and gentlemen, if you just joined us, this is Focus on Liberia. We are discussing the third wave of COVID in Liberia. My guest, Faith Akovi Cooper, she's the country director for IRC. And we have Naomi Tule. She's not only in the healthcare field, she's also a feminist and a human rights activist. And, COVID is also a human rights issue, but we'll come to that. Very recently, we say the U.S. Centers for Disease Control and Prevention issued a level 4 travel health notice, and the Department of State has issued a level 4 travel advisory advising against all travel to Liberia. And when we say level 4, this is there's a greater likelihood of life-threatening risk. Faith, you are there. How is this news being received in Liberia, and what are we doing about it?
Yeah, thank you. It's interesting because I think there's a frenzy going on Facebook. So if you're on social media, people have been resharing the alert that there's this advisory against travel to Liberia. And most of it has to do, again, with the fragility of the health system. If you're traveling to Liberia and you should come down with COVID and have severe cases, as Abigail put it, there are some basic things that we may not have. And I think it's within their right as the United States government or other countries to say that they are advising their citizens against travel. But let me also say this is not the first time. I don't know how many of you remember the whole issue about the June 7th protest that had to do with the missing money. There was also a State Department advisory against travel to Liberia because of the protest. So this isn't new. Whenever there's a situation of this magnitude that compromises your ability to receive the quality of care that you should need in the event of an emergency, CDC or State Department would issue that warning. I think it again is alarming for all of us, and particularly as Abigail talked about, the differences between malaria and COVID. Quite frankly, we're a malaria endemic country, and there's a lot of misdiagnosis, and that's why people are reporting very late with this new variant. And because it's so severe, what you find happening is by the time they get to the treatment facility, we had a couple of days ago, or at least last week, 2 arrived. As soon as they arrived at the Star-based treatment facility, they were pronounced dead because of severe symptoms. They waited too late.
Too late. Treating malaria.
Within 24 hours of arriving. And so that fragility of the health system would make any country advise its citizens that you won't have the quality of care. And I think it's quite standard. It could be attributed, they've done it before for crime and other nature. So it's within there, right? It just really encourages us to do what we can to collectively build the system and ensure Liberia is a better place for all of us.
Well, also, you don't want people coming, you don't need an influx of visitors or other people coming in that is going to put additional strain on the system that is already impaired. So
that's a very good point.
Everybody stay where they are until everything settles down.
That's a very good point. But believe it or not, we have testing on arrival at the airport. Not all country has that. We have testing on arrival.
Even when we test people, we tell them you're tested negative, but you may still be having the symptoms, you can still pass it. So just because you got tested negative and then you come into the country, you could still you could have been, the viral load could not have been high enough for it to test positive on the test. So you can still transmit that. So when they say no, there was a time where Europe was saying no Americans could go into Europe also. And so it's like, it's best stay where you are. That's what we told people at the very beginning. If you're not as sick, yes, stay home, because this health system, even in America, it became too much. We were working in the hospital, and it was like, you have this many patients to take care of, and people were dying left and right. And it was like, okay, get them ready, get the body prepared and everything, and get the next patient in, because the ER is overrun all over the place. So
absolutely. And
we'll come to the testing part.
Go ahead. So
we'll come to
that's
the
not where
part.
I was going, Abigail. Dennis, that's not where I was going. What I was saying is that even with testing on arrival at the airport, you find travelers coming from the U.S. and other places arguing that they do not want to be tested. So given what we're already dealing with on the ground, there could be an influx of cases also coming in. And I think that's the point that I wanted to make. But please,
don't they have to have a negative test before they get into Liberia?
You have to have a negative test within 72 hours. But upon arrival in Liberia, you also have to test.
Yeah.
Thank you. Let's go. Faith, you hinted on that already about the variant that is in Liberia. Yes. We are afraid because the Delta variant that we were combating in India. Some say that's the COVID on steroid. Let's talk about the different variants and what are we finding out? What is the true? How are we going to know which one is which? So how are we telling Naomi? How do we know what's there? What really is killing people now? Is it the Delta variant, other variants, and how do we determine this? Naomi, are you there?
It's frozen.
I think she's
okay. Go ahead, Faith. If you talk about the variant.
No problem. Currently, we have confirmed that Liberia is combating the Alpha variant. That has been confirmed. We do have the mechanism in country. And when I say we do, let me be clear. I do not represent the government of Liberia. I am an active member and participant of the incident management system. But having said that, we are able to test at the National Reference Lab for the Alpha variant. Even then, our testing capacity is limited. Results are coming out, a bit slower, but the IMS is working around to speed that up. The Delta variant, though, has not been confirmed in Liberia. 2 weeks ago, we sent seven samples to Ghana to test for the Delta variant. It came back as Alpha variant. But I will go on record saying the probability of having the Delta variant is absolutely high. There is high probability that Liberia has the Delta variant. However, we do not have the mechanism to confirm that variant is what we have. We do know that the Alpha variant, which is the UK variant, also is very severe. And that truly is where we are.
But do we know which variant was in the first and second wave? Was it the same Alpha variant?
I don't think so, but don't quote me on that. There have been multiple variants circulating. I think the second wave ended with the Alpha variant, but there was another variant in the first wave of the pandemic early on. But I can find out that information as we're discussing.
So are you guys sending your specimens to Ghana?
No, we're not. Specifically to verify the Delta variant, yes. But in terms of COVID, confirming COVID cases, cases that are not Delta variant are confirmed in country with the National Reference Lab. But I will say it's stretched thin. Do you
guys have testing centers? You have testing centers around the country?
We have a national reference lab. We have collection centers in all of the counties. Okay. The testing is done at the national reference lab. Liberia does not have the capacity to do testing and confirmation in each of the 15 counties, but it is working through. You hinted earlier about, when things slow down, the need to prepare. Absolutely right. There have been discussions about having regional labs, breaking up the country where you have a lab in Bong County that serves Nimba and Lofa, if you're familiar with the geography. Those discussions are there, but as we speak, there is one national reference lab that is testing all samples from around the country. And efforts have been made to bring in, as we speak, actually 48 hours ago, I think over 25,000 rapid tests arrived, which will be distributed to health facilities. But we also know the rapid tests are not 100% reliable. So if those should test positive, then it will go on to the National Reference Lab. And the reason being is to try to speed up because the lab is inundated with the number of cases and the backlog.
So the test you did. So
hold on.
Just one quick question. Sorry.
Yeah, Naomi, are you there now? Or are we still losing you?
Still frozen.
Just want to
She's
make
like
sure.
off and on because every now,
Yeah.
it's frozen and then
It's also raining heavily in Liberia.
Yeah,
So,
I think that's.
yeah, and she mentioned earlier being in Dwaza and the internet, lack of stability. So she'll come in and out.
Yeah, I just want to make sure that we're not leaving her out.
She's back.
Naomi, are you there?
That quickly she
All
froze.
right. With the fear of the different variants, Abby, can you give us a little more information that you may have concerning, these different variants, how they operate, and what we need to know?
That part I'm not gonna lie to you. I don't know the specifics of that. I just know we had the really bad ones that we had in the first, because from March of last year all the way to December, we had the first wave. Then the second wave started in the summertime in other states. Then we had this, but the only variant, the really bad variant I'm hearing so far, the deadly one, is the Delta variant, the one that was in India and all. That's just the one they say is like COVID on steroids, where you get sicker faster and there's a higher mortality rate. So if that's even if it's here, as you guys saw the videos and pictures coming out of India, and I think it's over here now in America. Last I heard from DC in the 49 states. So if it's in Liberia, God forbid, you're really looking at some, with everything else, with, like I said, with a lack of equipment, a lack of specialties, a lack of everything else that you need to combat this virus. God forbid, hopefully it's not there. So, and from what you're saying, my last question I wanted to ask her, if somebody got tested all the way in like a far off county somewhere, so that the specimen is being brought all the way to Monrovia to get tested first before you can get the results back?
There is mechanism in place to transport the specimen that's supported by US CDC, actually.
Mechanism as in it has to be driven from that county all the way to Monrovia? As
in it will be transported to the National Reference
Okay, and how long of a period does that take?
I couldn't tell you that. I think
is it a couple because usually when we first started our testing first, we had to send our, most of the testing was sent somewhere else. It took sometimes it was like a whole week before we got our results back. That was in March of 2020.
We've seen that.
So I'm just saying, so I can imagine for you guys it should be a little longer, but
it is, Abigail. To be frank with you, I couldn't say specifically because I'm not in the lab, neither am I a lab technician. Okay. But what I can say to you is that we've seen delays in the general public getting their results back, and I think my understanding is that there have been concerns around that. It's come up to the level of the national IMS, and discussions are underway. Even yesterday, there was a discussion around speeding up getting results back to people, because if we can do that within 48 to 72 hours, I think it would really start to help turn the curve. Because the bottom line is early testing, early detection, isolation are critical to containing the virus.
Let's go to the efforts, and thank you. You already stated some of those efforts to combat this surge. First, we say, why do we have this surge, and what is being done as of today to make sure to stop the spread? Naomi, do we have you now?
I know. Let me try. Thank you, Faith. I trust Faith. Faith and Martin have been on so many panels. I
feel like we're always on the same panel.
Always on the same panel. I know a lot about Faith. Faith actually led one of the women that led the Ebola response in Africa, so in West Africa to be specific. So Faith, having Faith here is a luxury for all of us. So when I go off, I'm like, she's gonna take care of it. But however, going back to the issue, so
Naomi, before you continue, they say there's a breaking news. Someone passed away from COVID in Monrovia. Is that news in Monrovia?
It's not confirmed if it is COVID. What is confirmed is that she died upon arrival, and I think I will wait for the family to actually see
Right.
it.
Okay.
One
Sure. Go ahead.
upon arrival.
Okay.
Yeah. So one of the issues that have affected our community, and it's not an isolated case. It's not COVID, lack of trust within the health system in the community. The community don't trust the health system for so many reasons. When you go to the hospital, there is long waiting time. You're going to wait for so long, and you're not even going to see a qualified medical practitioner to take care of you. And the medication is not going to be given to you. You're going to be given medication to purchase from outside. So a lot of people is frustrated over the system. And this system is not only unique to a couple of years back. It's way 14 years ago since Ebola exposed our fragile health system. It stay continuing. However, what is happening right now is that we need to build on existing structure. What happened during Ebola? Yes, Ebola is infectious disease, might be different from COVID, but again, there was an approach. There is a system that helped to stop the spread of Ebola. And Phil has said it requires everybody effort. The multi-sectoral approach. How can all hands come on deck? How can we now start to encourage the people within the community that, hey, what you are having is not malaria. What you are having is not cold. Go to the hospital and get tested. Listen, a couple of weeks ago, we were shut down. We were shut on testing. A lot of people were being encouraged to go for testing, and they never had test and kit available for them. That again created another breach within another gap within the community and the health system. Responding need to be effective so that when you have the mobilization team in the community creating awareness and creating that trust that need to be in the community, once the community people or the service user go to access the services, it should be available to them. And it comes back to the vaccine. How did we reach to the place with a lot of misconception about the vaccine? And it's not only Liberia. Before even the vaccine was brought to Liberia, we saw videos about people in the Western world saying that the vaccine wasn't real. You're in America there, you know you have a whole set of people who say they're not even going to take vaccine. It's the same thing to Liberia. All different. We need to encourage our people that we cannot compare ourselves to the system that is established. You need something to help to prevent the risks, to prevent the symptoms that will happen when the virus gets you. Again, I listened to a commercial, a jingle yesterday and was saying, oh, the vaccine will prevent you from getting the virus. No, the vaccine minimizes. We need to be careful because if somebody take the vaccine in the community and they come down with the virus, again, it's going to create panic that they lie to them. So we need to simplify the messages, need to break it down as simple as possible to the local people so they can go and get tested before even getting the vaccine. We need to mobilize our community so that when somebody is sick, they can be able to provide our first aid support before taking in for testing. We also need to find local techniques. What are the things that people are doing when you feel you keep in contact with somebody that was sneezing? They steaming. It requires less money and transportation. Steam yourself. The next day, go to the hospital. We need to encourage people to drink hot tea. That us build your immune system. They might not be able to have the vitamins and so, but eat the ions, eat your potato greens at your backyard, eat healthy, stop drinking, take enough warm fluid, do the steaming, go to the hospital when you feel really sick. Because if we start to say everybody, once you are sick, go to the hospital, couple of weeks, JFK were overwhelmed. People were sitting on the chairs with strip in their hands. And some of the cases could have been treated at home, although we're not saying stay home and treat yourself. But we need to ensure that we are attending to the right people at the right time, then to allow everybody just rush to the hospital and the nurse is going to get overwhelmed. The people who need immediate care are not going to get the immediate care. So it's just complicated. I was telling somebody yesterday.
It is. It is. And so with the complication, what is the effort now to stop this spread that are being put in place or that we are thinking about doing?
I think we are already doing it. A lot of CSO are in the community creating awareness. Trust will not happen today, will not happen tomorrow, but it's a process. And one of the process is trying to talk to people people trust. That means looking at young people who are within their own community and telling them, building that strong allies and making them to understand that the virus is real, so they too can be able to talk to their parents, to their colleagues within the community to ensure that they are doing the right thing. So that's one. The next thing is also to talk to our development partners, ask for more help. We need all the help we can right now in Liberia. Trust me, this is not a George Weah thing. This is not with the minister of health. This is not an Enfield team. Nobody here should be blamed. Let us help to stop the spread. Once everybody is okay and healthy, we come back and we will blame everybody. But right now, our focus should be on response, save more lives, save our community, so our country can get back and running. Then we can be able to make informed decisions based on what has happened. But right now, it's not the time to say who's not doing the right thing or who is doing the right thing. Right now, it's time to put all hands on deck, respond, save more lives, stop the spread of COVID, so Liberia can get back running.
Thank you, Naomi. One thing I want to know here is that, who's the person responsible to pass on the information, especially when it comes to all the research, the statistics, and everything that has to do with COVID. You must have one person that is the head that can come on and give updates. Let me give an example. Like here in the US, we had Dr. Fauci. He was the one in the front line. He got latches from everywhere, every corner. And he was still in the front line telling people, this is it. Whether you believe it or not, this is the case. Who's that person in Liberia? Because you got to have someone that we can hold responsible.
Exactly.
Yeah, we got to have someone that can be in the front line and say,
everybody's saying don't make it political. Yeah, they're saying don't make it political. Don't blame this person, don't blame that person. These are all political appointees. These are people who are paid, operators who are paid to do the work, to coordinate, to send all the information and all the different personnels and all that to different agencies to get everything coordinated so everybody's speaking one voice. You can have one person telling you the vaccine is going to prevent it and another person telling you the vaccine is only going to minimize the symptoms. So you have to speak all with one voice. Yes, there's going to be a little discrepancy here and there, but you have to have that person that says, this is the person, the Minister of Health, this is the person of Assistant Minister of Health and her team, his or her team, because she's female, to do this. You cannot say this is not political. People keep saying healthcare is political. It's political.
We just want to use this medium to encourage more Liberians to take it serious.
Yeah.
Trust me, I'm more political than any. I'm a feminist. I take everything. The personal is political. My approach right now to COVID right now is just to save more lives. Because trust me, my husband right now, my help, all my domestic servant has to stay home. I'm a full-time mom, I'm doing everything right now. It's overwhelming for me. I need to go back to my normal life. So I want
the women who don't have that luxury. What about the women? You're feminist. What about the women that don't have the luxury to have?
That's why you see me talking right now. That's why I'm not going to say fire is in the hole. That's why I'm not saying fire is in the hole. That's why I'm saying let us fix this. I recognize that there are issues. I recognize that there are gaps. There are leadership issues, yes. But without the leadership issue, can the community take this thing and stop the spread? Yes, they can.
So the question being asked is who is that one person?
Yes.
Who is
leading this?
So listen, we have the IMS. The president established a response team. Right. From the first response. I assume that response team is still working, headed by mostly females. Besides that, there is IMS where you have all of the partners, the donors, government go, and there is a report update. One of the things that I know that we have been consistent on is giving the data on who is infected, how many person die, how many person recover. We have had that. There is a gap in communication. And that gap in communication is actually creating panic, disbelief in what we have within our community. That's a fact.
So let me come in on this. There are three things that are critical in a pandemic response or disaster response, regardless of what it is you're fighting. It could be flood, it could be fire, pandemic, you name it. Three critical things, the 3 C's: coordination, collaboration, and communication. So I'll repeat that again: effective coordination, strategic collaboration, and effective communication. And quite frankly, I will say we haven't done that as well. So we could sit here and do the blame game. I 100% agree with you. Health is political. And if you don't have the leadership guiding it, you will have a fragmented approach. We know that. So, Pastor Blah, to answer your question, that one person should be the health minister, who is the chair of the incident management system. That's what we know. That's the structure that has been in place. That the incident management system is coordinating. You've got support from the international players, from the CSOs. But I will say, even from the INGO sector, we need to coordinate better. You've got RSC doing this to support other organizations doing something similar or different to support. So there has to be a unit and one approach that is clearly coordinated. And we are lacking that. And we're not exclusive. The United States was lacking that for a long time. Dr. Fauci was saying one thing, the leadership was saying something else. But we're not going to compare ourselves to the United States, nor other countries that are having a challenge. The fact remains is that this thing has got to be looked at from an all of society approach and all of government approach. You often hear it's a health crisis. No, COVID is not exclusive to health. You brought up the women. The marketeers, the women in the market is impacting them, their ability to survive. Okay. The petty traders across the borders, the health workers, everybody across every socioeconomic status is impacted. But one of the things that has worked in Liberia and worked for Ebola is this idea of community health system strengthening. We haven't talked about that much today because we have such a fragile health system, particularly in developing countries. There is this structure that's put in place called community health system strengthening, where you rely on the community to actually do surveillance in their community and report that back. During wave 1 and 2, you talked about, Abigail, you asked what kind of training? Community Health Services Division of the MOH and other departments were working to try and strengthen the surveillance system, supported by USAID, RSC, GIZ, multiple partners across the board. Even Naomi's team, they're doing community health system strengthening work. At the end of the day, because we have this fragility and we don't have the space, hospitals are overwhelmed. They are turning people away as we speak. You're going to have to rely on the community structure to identify sick people in their communities who are hiding at home, report it to the county health team, because there's a decentralized structure in terms of the way Liberia health system is set up. And once they report it to the county health team, determine how we can get support in that community. Is it 100% working? Absolutely not. Are we 50%? Probably not. But certainly we could do better with coordination and collaboration. And that's the point I think Naomi was also making.
And talking about that coordination and collaboration, and I love the 3 C's. On June 18, 2021, the Ministry of Health revised its COVID-19 national guidelines due to the increasing number of coronavirus cases being reported. And here are some of the measures. Passengers who have been traveling from India, Pakistan, Bangladesh within the last 14 days will be allowed, or will not be allowed entrance, or will be maybe I'm getting that wrong. Will not be allowed. All persons shall mandatorily wear masks and show social physical distancing and wash hands with soap and water or use hand sanitizer. And B, to that, ensure that all persons tested positive for COVID-19 and contacts are required to comply with health authorities and related health rules. Another protocol. Public offices are required to reduce staff by 50% while others are at home. All institutions of learning, places of worship shall remain open but strictly follow the health protocols listed in count 2 above. Large gatherings of more than 20 persons, including parties, weddings, vigils, wake, funerals, are disallowed. Sporting events are allowed, but only in empty stadium, no spectators. Restaurants, cook shops shall remain open, provided persons and staff in attendance follow the health protocols listed above, and so on and so forth. Those are beautiful. Whose job it is to make sure these things are adhered to? Do we have one? Naomi, you are laughing again.
I am not
Your policeman think that you won't run and you want to arrest. Who
full
job
of government, Naomi.
everybody should take responsibility. Everybody should know that COVID, it's high because currently this is what our health ministry is saying. Besides me being Executive Director of Community Healthcare Initiative, I'm also part of a women network called the Liberian Women Humanitarian Network. We just issued a statement asking government to ensure that all schools are closed, and also pushing that we put a robust restriction on movement, maybe suggesting a 3 weeks stay home, shut down 3 weeks, and only have essential staff or people who do the businesses go, just petty traders have certain time that they go, like what we did during the first response. It is necessary right now. It is necessary. The government was able to put all these strong measures in place and say our children should still remain in schools. How? If you're going to say only 20% should attend a funeral, if you are saying that within the Ministry of Education, they should cut down the staff to 50%. The same Ministry of Education is allowing children to remain in school, that our classes are 50 and above, especially in public schools, should remain in school. I don't get that. Markets are still packed. There is no restrictive on movement. The next thing that comes to mind is that you have most of the young people are asymptomatic or pre-symptomatic doing testing. We have had family who maybe the husband died or maybe somebody got infected and they are in a treatment center, so everybody got to come for testing. Everybody will be showing signs and symptoms beside the young children that within the home, and they're going to come up positive, but they are actively in school and they are not showing any signs and symptoms. Then people start to think, are they the one giving it to their teachers? Are they the one bringing it back home to their parents? So Ministry of Education have a good argument that the children are not getting sick. Yes, they are not getting sick because they are not showing signs and symptoms. But within the last 3 weeks, we have more schools administrators getting sick or dying to COVID.
They're super spreaders.
So the children are super spreader. Why are you keeping them in schools? They are coming home to their parents who already have pre-existing conditions that they are not aware of, because we don't do physical in Liberia. We only go for treatment. We don't do no preventive care here. When you are sick, you go to the hospital. You don't go when you are feeling well. No. From I work in the hospital over 6 years as an RN, we were every day in the hospital in Liberia is an emergency. You hardly see people just coming in to walk. Everybody, every day, you are ER nice. Whether you on peace or message or you are ER nice every day, because you have emergency cases coming. So we say that to say that we still need a lot of leadership on this COVID response. Yes, we don't want to be political, but we need leadership. We need people to come out and show some leadership. We need robust action. It will hurt us. People say, oh, what happened to people who can afford food? And all. We did it the first time. The stimulus package, people are yet to even receive anything. So if we did it the first time and we were able to stop the spread, we reduce the spread in a very, very significant way. Why can't we do it now when people are dying? So it just...
Thank you, Naomi. Thank you. We're going to talk about the misconception. So when we come back, we'll talk about the misconception, the superstition, what is responsible and how we're dealing with it. But we'll take a short break and we'll be right back.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus on Liberia uncovers and showcases the best of Liberia and shows the world the truth about Liberia. We educate, elevate, and promote all things Liberia. We conduct interviews, panel discussions, debates, and more. Tune in to Focus on Liberia on Facebook and and YouTube and be a part of the stories that make up the news.
This is Focus on Liberia, and I am Dennis Ja.
You still.
Welcome back to Focus on Liberia. We continue our discussion on the third wave of COVID vaccine, or the third wave of COVID-19 in Liberia. Now we turn our attention to the misconception about the vaccines and about COVID-19. Abby, let me start with you. These misconceptions, superstition, not willing to take the vaccine, they are not unique to Liberia alone. What are some of the superstitions, the misconceptions that you're hearing, even right here on social media and other places?
Well, people are saying, I've been hearing and reading, Bill Gates paid for the vaccine so he can depopulate the earth, try to get rid of the African population. And if you take it, they're putting this chip inside of you. Also, if you take it and, everybody's menstrual cycle goes out the window, and they're putting magnet in you. Even, I don't want to talk about, you had this doctor who was in Ohio when they had their press conference, or they had their community hearing, where she said, if you get the metal and you put it on you, and they had this nurse there who had this metal on her, and then she trying to stick it to her neck and it wasn't sticking. She's like, oh my God, well, you got the point. I'm like, you're lying. I don't know why you say that. It doesn't make it's not true. Nobody's putting any metal in your body. It's been tested. And the main thing was because as health professionals, all that too, we're always like hesitant. You take a nurse into the hospital, be like, oh yeah, you need blood. We'll be like, yeah, wait until my hemoglobin is like dead before I get blood, because we're always hesitant about doing anything to ourselves and all that. So it was like, okay, why did they, manufacture this vaccine so quickly? Many of these things take a little longer time, but when you have enough money, when you throw enough money at something to make it manufacture faster, that's the reason they were able to come up with it faster. I didn't take the vaccine the first time. I didn't take it. Well, I couldn't get to it because first they were offering it at my hospital, and then when I changed jobs during that time, and I said, well, let the older people get theirs, and everybody. And then finally, after 100 million people got it, I'm like, you know what? Yeah, it's time to get it. There are some health people that I work with, that I used to work with, who still won't get it yet. They say, no, long-term complications. And there are many things about the vaccine that's pretty safe, but there are many things that we still don't know. And science is not exact. We're not going to know everything, but as of now, they're telling you it's safe. They've done so many tests, and there's so many people, 100 million people in America have received it. The first dose and the second dose, I think we're like 66.5% so far received all of them, both doses, if you don't take the J&J. So, it's pretty safe in there. And of course, you're being monitored when they give you the vaccine. You get the vaccine first. If you have low risk, let's say if you don't have heart disease, diabetes, or asthma, COPD, you sit on one side, they watch you for 15 minutes. And then those of you who are higher risk, they'll watch you for 30 minutes. They also tell you, you have your card. They have the number there you can call, because they're also getting, information from everybody. Those of you who are having side effects and all that, call the vaccine center, and they're writing everything down. So they're ongoing studies. They're always researching. Okay, 3 months from now, they're going to come up and say, okay, this is this is that. But for now, it's safe to take. It's safe to take. I tell people, I say, especially if you're high risk, diabetes, pregnant, it doesn't. And all these myths about this is going to happen and then it's going to do something for the universe and all of that, that is not true. That is not true. So it is safe to take. I can't say we can only give you the risk and the benefits. You can say, okay, well, this is a disease where you can heal up. I always thought the underlying statement I'm going to make today is everybody can get the disease. Yes, you may survive it, but everybody doesn't respond the same way. It's not the kind of disease where you say, okay, yes, most of the people will be healed from it, but healthy people have died. People are like, oh yeah, you didn't have any pre-existing illness, any major pre-existing illness, but healthy people have died from it. So you don't know how you're going to respond to it. So it's best that you protect yourself, at least give yourself that protection and your family that protection, so you don't have to deal with it. Now, it's not a guarantee, but at least if somebody told you, if you sit in the car and you wear your seatbelt, yes, you may get in an accident, but the seatbelt may save you and have a higher chance of saving you. Would you say, no, I'll take my chances anyways? Why would you do that? You wouldn't do that. So why would you do it? This is basically your seatbelt, your helmet, and everything to protect yourself and make the chances of you getting sicker less or decrease the chances. So once again, many people may get it, but you don't know how you're going to respond to it. So it's best to protect yourself.
Thank you. Let me put my co-host on the spot because she's a pastor. There's a bomb. They pass the church people.
Please
say there's
do,
a
because
bomb
people are following church advice.
in Gilead, right? Some guys say, I don't take chloroquine, I take prayer queen. Some say it's the 666. How much of this misconception and disinformation coming from the church, Pastor?
Well, there are different churches and there are different people, different pastors, different beliefs, and all kinds of stuff going on. So, there's difference between faith and there's difference between foolishness.
Right.
Yeah, and God, God is not. People think God is just a straight jacket. He's one way. This is how he goes, and there's no turn. He don't go left or right. So they do things. People do things. That the way that they do things, they expect God to be like that. No, it's not like that. God has given us wisdom to use. He said wisdom is profitable to direct. So there are times in circumstances like this, the healthcare system will be advising you on the best way possible to keep safe. You need to use wisdom. You need to understand that this is for your safety. This is for life, And so there are all kinds of misconceptions in the church too. People have been preaching different stuff. Some say it's a 666, and some say I can't remember the rest of the stuff. But nevertheless, people need to understand here that God is concerned about our safety. And it's not only our faith, it's not only telling the next person this is what you ought to do because I believe that is what you're supposed to be doing. People need to use their own discretion. They need to understand this whole thing that is going on and not make a decision concerning their lives based on what they just heard from one person. You need to hear the pros and cons of everything as it concerns your health. So God, there were times in the word of God that God said people need to step aside and be silent and stay indoors. When the plague was going on in Egypt, God told his people to stay indoors, and they stay indoors. There are commands, there are instructions that God gave his people at the point in time. The very same people that are saying, "Oh, the vaccine is not good," some of the pastors will say they don't take medication. But the very same people that telling you they don't take medication, in the bag, they are taking that medication. Some of them got high blood pressure, some of them got diabetes, and they are taking medication. But when they stay in front of the congregation, that's another story. You need to make your health decision for yourself. Your faith is between you and God. It's not between you and the pastor. No. What you believe in is between you and God. So you need to go back to God. God, I need understanding. God, I need a sign. God, this is what they are saying. Give me a prompting. We need to go back. That's why it's good to have a relationship. Nowadays, people don't want to have a relationship with God. They want everything the pastor should give it to them. They go to church, the pastor should prophesy, "Oh, receive it," and then they shout, "I receive it." They are just joking. People are just joking when they say, "What are you receiving?" Sometimes the pastor will tell you, "Oh, you are receiving, or you're going to get this amount of money." And then they shout, "I receive it." And they just think, receiving the principle of wealth and riches. There's a principle that God has said. It's not by receiving. It's by application of that knowledge that God has given unto you. That's how you get the wealth. So,
thank you.
1 minute. Dennis.
Yeah, you can have a pastor as co-host. That's what you get.
I know the pastor got to preach.
But the thing also with religion is, like my friend always say, Africans always got to outpope the Pope. We have to prove that we're more holy than even the person who brought us the Bible. And even and we also, because of the poor healthcare system, again, we've always relied on religion. Because it's like, oh my God, Ebola came and we prayed to God and then God took Ebola away. Well, a lot of people work in the court. It wasn't just God. And I worked in the Catholic hospital for the past 20 years. I always tell people, my patient asked me, "Oh, you pray with me or this person pray with me?" We had the nuns and the priests and the rabbi and everybody, the spiritual care department. but they were all educated to know their place.
Yes.
When they call the code, there was the nurses there, was a respiratory therapist there, the pharmacists, the doctors, and everybody the spiritual care team member was there. They weren't in the code. They were standing outside and waiting to speak to the family members and speak to the patient later on, God, if everything turned out okay. But they weren't jumping in there saying, "Oh, let me pray. You're moving. I mean, God can wake this person up and God can do this and all that." No, they're praying outside, but they're not in the room. So they're educated. They're not just educated just in the Bible, but also educated to know that when you're working in the hospital, or what the Bible says, and what science says and all that, and there's a place. Like I always tell people, science and medicine can coexist. They both, sometimes they have to go apart and all that, but they can coexist. And a smart person, not smart as in the way in that way, but to know the difference that yes, I can also believe in God, but I can also believe in the fact that God made these people and give them the knowledge to do what they're supposed to do.
Exactly.
I tell you, I can pray with you, but can you sign this consent form? Because I know
whether you take medication
we need to wrap this up. Let me get to my panelists from Morovia and see what they are hearing, because it was one pastor who was praying for a patient and he was stepping on the oxygen and the patient was writing, but this pastor was so full of the Holy Ghost and he kept, preaching in tongue. The man gave him the note, he put it in his pocket and was still blasting in tongue. After praying, say amen, he read the note.
He says, "I'm dying."
He said, no, he said, "You own my oxygen." By the time they got to the patient, he was already dead. The pastor killed him. But anyway, what are some of the misconceptions in Morovia there that you're hearing? And besides churches, besides religion, we also have culture. Somebody say, "I can eat too much pepper, so no COVID can catch me." What are some of the things that you are hearing, and how are you fighting those misconceptions about the vaccine, about COVID as a whole? What are you doing about it? What are the misconceptions? Let me start with you.
She's frozen.
Faith, let me start with you.
Great. I mean, quite frankly, I think Abigail touched on several of them, misconception. There is just general distrust about the vaccine. And let me just start by saying 90,271. That's the number of vaccines Liberia has received thus far. 90,000 for a population of 4.9, and I think we're over 5 million. I don't know when last we did a census, so I won't even start there.
2008.
Exactly my point. So with 90,000, I remember when the first batch of vaccines first arrived, the awareness wasn't as strong. And of course, people were skeptical. Why should I take this? This was created, as she said, by Bill Gates. It's going to put a chip in me. My pastor say I shouldn't take it. For those that are, still of childbearing age, we won't be able to have a baby. You name it. I mean, you could go down a list of misconceptions. But what's really striking for me is that of that 90,271, 60% that have taken their vaccines are men. And that data just has me wondering. I'm like, 60%, usually it would be more women taking the vaccine. The other thing is that in April and May, when the vaccines first arrived, now we could argue this point, but the fact remains, underdeveloped, there's a vaccine inequity. Developed countries have been able to procure, they've been able to procure it fast. And quite frankly, we talk about, yes, resources thrown at creating the vaccine, but remember, SARS, science behind SARS, COVID-19 is a form of SARS. It's been ongoing for years. And remember, they were working on an Ebola vaccine as well. So they've been able to pivot to create the COVID vaccine. So I don't think it was too quick at all. I think it's been in the work, but as Abigail said, with resources, billions of dollars thrown behind it, they were able to quickly release it. But I think the awareness has been an issue, particularly for us on the continent, and giving all of our cultural beliefs and people wanting to use, local remedies and things like that. But in April and May, when the vaccines first arrived, I remember I took my vaccine in April, my first dose, April 14th. On a daily basis, we were recording across Liberia about 40 to 50 people taking vaccines. By the end of May, we were probably around 100 or 200 or so around there daily taking vaccines. When we started to see the numbers increase and the rise in death rate, you better believe MOH and other facilities were seeing 500 plus. So it's taking a catastrophic event of these number of deaths to get people to wake up. The people, I remember telling my own staff in my house, you have to take the vaccine. Oh no, my pastor said not to, and da-da-da-da-da. To be honest with you, they came to me a couple of weeks ago and said, where can we take the vaccine? And what happened is that Liberians sometimes we're slow to act. We take everything for granted until it personally hits us.
That's right.
We've seen people dropping down suddenly. There is an outcry for the vaccines. So of that number, we have to date 84,800 that have been vaccinated. 84,800 in Liberia. We still have a serious issue. Of that 84,800, only 5,000 have taken their second dose. So there still needs to be awareness. People took the first dose, some are not going back for second dose. And then there's the issue of just the coordination around the vaccine was also a challenge. People will go to this facility, it's not there, So there's a lot. But what I can say is that we need to do more. Perhaps the government needs to prioritize resources to buy its own vaccines as well, because the vaccines that are coming in now are donated by the World Bank, the African Union, or the Africa CDC. If they don't donate, then we don't have vaccines. We're expecting
Politics.
Exactly. We're expecting 345,000 to come in from J&J by the middle of July, August. But the fact remains is that we need to buy more. There's vaccine equity. We only have AstraZeneca COVID as we speak. We did not have Pfizer. We did not have Moderna because the high power nations have been able to buy them up. And also we haven't prioritized. So I think there's a lot of misconception, but what really could happen again is this whole coordination around the awareness, making sure every sector of society understands the benefit of taking the vaccine. Some of the people who lost recently, had they taken the vaccine, their cases could have been mild. We don't know that. So it's
another misconception about the vaccine is that most people that took the vaccine, they got sick, very sick, and some of them died. So we want to know, are there any data available of those that took it, did they get sick, and what the percentage like? Is it high? Is it low? Because that's some of the things that we're hearing around.
I have not heard, and I'm not saying it hasn't happened. Naomi, you can come in. I have not heard of anyone dying from the vaccine in Liberia. I have not heard that. Trust me, Liberians are good about taking to Facebook. That would have been out there. I haven't seen it. We know of it happening in other countries, but I haven't seen it. But there are also unexplained deaths in the community. You don't know. But I am not aware of anyone having taken the vaccine and dying from it. Now, there have been, just like everyone else around the world, you do get some symptoms of fever, headache. When I took the first dose, I had a headache for 2 days. And I had a fever, so it went away. So I think it's something to keep in mind. Yes, misconception, but I don't know of any deaths related to the vaccine.
Let's bring in a few comments, and after that, we're going to talk about what we do from now. How do we advise our people? How do we? But let's get some comments here. Where the Simpsons say, what needs to be done differently now to arrest the third wave? And jot that down so we can talk about that. Sylvester say, let's take precautions. Willie say, travel warning for COVID should not be compared with any other. And some information here, somebody's calling wrong information, I'm not sure. Willie say, is in favor of sanctions in this instance. The vaccine must be encouraged. Rebecca Nosiboye say, great job, thank you. Also, Willie is saying we should assign the blame and move on. That's not enough, Willie. No, Abdullah, no more flight coming from India. They are infected with the virus. Don't say that.
That's interesting.
Clement, politicians alone can't do it. It requires everyone, all hands on deck. I applaud you all for this forum. Please keep it up. James Davis said, thanks for the expose. Let me start with you, Naomi, if you can address that question, what's being done differently to arrest the third wave?
So currently, as we all been saying, is that we are still at the level of trying everything. I think right now in Liberia, we are just trying everything, just seeing what can work. I haven't seen what have been done differently yet. There is still coordination issue. Faith spell it out. There is still it's communication, coordination, and collaboration, right?
The 3 C's.
Yeah, the 3 C's. We still have gaps. What I think should be done differently right now is that everybody should take this very personal. Our community have a big communication issue, lack of information. We have a very high illiteracy rate. We have people are ignorant. The race communication team at the IS level, at the Ministry of Health level, need to do a lot. There should be a lot of awareness messages going out there so people can believe, and it should be coordinated. We should have everybody saying the same thing, especially those that are in leadership with this whole COVID thing in this country, from the Ministry of Health to Enfield to the IS, that whoever the partner, we should have coordinated approach. One of the things that I know actually worked during the Ebola crisis was the 3 or 4 W's, all the INGO. I think Phil was one of those that came and also helped to train, and we had the incident management. There was a whole department, there was whole place set up just to respond whenever there is disaster. I think it was the disaster management. I'm not getting it right now, but she can help us. But there was a whole division set up just to respond whenever there is any form of disaster. So they too need to come on board. I don't know how much they are involved in this whole COVID response, because people seeing it as a health issue. We need to bring everybody on board currently as we speak. And we need to know that one size cannot fit all. When you talk about social distancing, yes, we were social distance in the community, in the public place. But when we come home with 16 sleeping in one room, one person got COVID, all 16 of us going to have COVID. So it's different things. We need to look for what applies to us within our own context. One of the things that we need to also encourage is that we need to encourage more young people. Young people need to be the messenger of these messages because they are asymptomatic. They are the carrier. They should be the one encouraging their friends to wear the masks. They should be the one encouraging the old people to get tested. I think we need to have more young people within the response. The third thing I'm also going to say here is that the COVID vaccine currently, as you speak in Liberia, we are not taking statistics. And that is one of my worry right now as I speak. When I went to take my vaccine, I don't know for you, Faith. Nobody asked me the only thing, do you have any signs and symptoms like cough, cold? That's all. No one to call. Like when I got vaccinated, I was coughing 1 hour. I got vaccinated. Right after my vaccine, I coughed 1 hour straight. I was so confused. Even I talking on the phone, I was just coughing. And after 1 hour, I was fine. I never had any fever. I never had anything. And I went for testing because I was confused. Then someone said, but you just took the virus, going for testing. I said, I just took the vaccine. So within 3 hours, the vaccine will not be active. If I will say positive, it can be the vaccine. But again, we need to be able to document our experiences because based on how we manage what happened to us, we help other people and can also minimize the fear within the community. So we have a lot to do currently as it relates to our approach. So that's why we are saying that don't say government, don't say that and wait for government, because the people that are dying are not government. They are our own people. So we need to encourage our people, wear your masks, wash your hands, ensure that you are steaming when you come from out. Maybe you don't know who all you came in contact with. Just steam, make a pot of hot water, pour a little bit of salt, allow that steam to inhale it for 15 minutes before you sleep. And it also reduces your risks because we know that the virus is stopping your upper sinus. Just so we need to try all of our local mechanisms that we have because our health system is already stretched and overwhelmed. So what we need to do is how do we help ourselves at the community level is very, very important. And Faith couldn't have said that any better by talking about the community health system strengthening. Community health system strengthening, we need the CHB. the CHA at the community, the TTMs at the community, because these are the people that people go to when they feel sick in the community. How do we equip them so they too can be safe and be able to and bring out the cases from within the community? I think we actually really need to do a lot of work as it relates to the community approach, as we rely on our government to bring in more mechanism, to bring in more vaccination, to sort professional support wherever they can, and ask our international partners to continue to help us. And one of the things that the health minister said on one of the call I was on a couple of days ago, she said that the vaccine that came in first, the Asa vinegar, is short on the market. So those of us that are due for our second vaccine, she is also consulting health expert if we can be able to take another brand of another vaccine. So it's something that we need to start thinking on right now. What are the adverse reactions are going to happen? Because the vaccine is not unique to that. You are on the market, it's not on the market. So you have a lot of people who took vaccine last month due by August. They due this month. They don't have the second dose of vaccine. By next month, we're going to have 2 different type of vaccine in Liberia. People due for the second dose, 2 or 3. So again, we need to start to have those communication right now, so the people at the community level can be aware. When people are aware, they make informed decision. But when you keep it away from them, then somebody form a big lie and say it just because the small truths they know that you've been hiding. Then again, you break the trust that you're trying to create between you and the community people.
Thank you. Let me read a few comments and then we go around the room and advise the way forward so we can end the broadcast. Johnson Brown says, it seems like most Africans don't believe science but believe their pastors. Jimmy Eastman, if education is key, we must have public service programs like what we have now that will provide the people awareness and instructions of what to do to combat the disease. Musu is here. Welcome, Musu. James Ledlon, reprioritizing of resources by the government towards procuring more vaccines is very critical at this juncture. And we didn't touch on RIA. They are taking tests and they are charging $75. We want to see where the money, maybe we can use that money and buy vaccines, but that's another story. Right?
I agree with that.
Barbara Cooper said, my dear, they asked us here, but we lied through our teeth. We were desperate to take the vaccine. Barbara, I'm not sure what you're talking about. What fast relief actions can we begin to mobilize to fight this disease? Musu is asking. Edmond Gator, so why not make a hashtag and spread the news on social media?
Great idea.
Use the Ministry of Information to spread the news. Edmond, we can begin that and contact us. We can start right here at Focus on Liberia. Musu, are we reaching out to friends and partners across the world to help us with equipment and supplies? And at this point, we should not wait for government. They shouldn't be citizens. This should be a citizen undertaking. And Phoebe Warete said this very good awareness program. And, talking about going to our health partners, there are certain things we can do today without going to anybody, right? As we learned, this is rumors that when people take their tests and before the results come, they have to put them in hotel. So the guy who's driving the bus from RIA to the hotel is bribed and he take you home. I don't think any international partner can help with that. It should be ourselves. So there are a lot of things we can't ask anybody. We're supposed to really do ourselves. And I don't know to what extent we're doing that. But let me get your comment on your feedback on the comments just read. Let me start with Faith. And then we go around the room and see where we go from here. What advice can we give?
Thank you. This has really been a fruitful discussion, and I like the questions across the board. Let me just say what's unfolding in Liberia is worrisome. It's concerning, given there has been 700% increase in cases, as I talked about in the beginning, and the death rate. And again, I think this upsurge is driven by inadequate adherence to public health measure. It's also attributed to the strain that we're fighting. But I think what can be done is the need for a collaborative approach. I think as someone who has worked in pandemic preparedness, I will always say, coming back to the 3 C's, the collaboration, coordination, and communication. And with that, there is also a need to look at community mobilization. I think it was Musu Stewart who said, how are we encouraging our friends and family? What can each of you do? What can each of us do to help bring awareness? We can't only rely on government. We can't only rely on the IMS, but each of us have to play our part. I feel we have a moral responsibility to do more, to help Liberia get this under control. We need to strengthen our surveillance system. One of the things I'm seeing in the last few weeks, every politician is out there running from county to county with, I donated this with stickers on it. We need to stop politicizing COVID. The fact of the matter is, yes, all health is politics, don't get me wrong. But when it comes down to the response, we need people to just come together and be a unit to protect lives and reduce human suffering. So there's really a need for everyone to understand you have a role, for the community to do what they did during Ebola, for us to even look at the possibility of another lockdown. Maybe if enough citizens call for it, Uganda has locked down. Namibia is thinking about it. Other countries are starting to lock down. Rwanda. What makes Liberia an exception? I understand the impact on the economy, but for a few weeks, we can try to get this under control. So I really think there's a need for all of us to, one, adhere to the public health measure, play our part, even if it means a phone call to your family to tell them to get the vaccine, to tell them if they're sick to get tested, to stop suspecting that they have malaria. A few weeks ago, my driver said to me, I think I have malaria. I said, stay home and don't come back. I will drive myself until you get tested, because at this point in time, you can't take the risk.
Exactly.
We all have to understand we need to set examples. So I think this has been, I feel like you need to do a part 2, Dennis.
Definitely. We didn't even go halfway.
A part 2.
We didn't even go through all the questions. It's serious.
And yeah, I'm going to pick on Abigail and say maybe it's going to be the politics of COVID-19.
So Abigail, what do you think is the best way? I mean, let's get your view on how do we stop the spread? What can help?
I'm like this. I don't know this steamy thing everybody keeps talking about. I don't know what that is. Most important thing, wash your hands. I have a video on my phone. By the way, I am a health blogger. Abby Tyler, Healthy Living. See that? If you're on Facebook, look me up and become a member. Sorry, shameful plug, everybody talking like, let me talk about more now. Anyway.
I've been waiting
I didn't know that Liberia on the tour was still. I was waiting for it.
I have to. That's why when I have Liberian patients, I have to translate for them so I know how to speak my Liberian if I have to. But anyways, wash your hands. I did a hand washing thing, a video a while back with Ebola stuff. Wash your hands for at least 30 seconds. I know the running water there is not readily available, but if you like they had before, the water in the bucket, keep it clean every time, try to refresh it, don't let it just sit there, let little spickle. Make sure you wash your hands, make sure you wash in between your nails and everything, rub with good all your wrist and all, because everything splashes back. Do that every time you go to the bathroom. Try to stay away from as many people as you can. I know in Liberia everybody like this communal thing, but just say right now you can't come to my house. I can't come to your house. Just stay where you are. If you have to go to the market, go to the market. If you have to go to the store, you go there. Or try to buy as many things as possible, so that way you don't have to keep going back and forth to the market. I know kids, they have to be in school, so make sure they're wearing their mask, and wear your mask the way you're supposed to wear it, over your nose and all the way below your chin, not halfway through. Take it off if you have to eat, put it back on as much as possible. Don't keep touching the outside of it, because that's where it's contaminated, on the outside of it. So try as much as possible to kind of reach over and pull it up this way or pull it down this way. Don't keep touching the front of it, because like I said, that's why it's contaminated. Eat healthy. I got my thing when I got my garden in the background in my backyard. Make sure you're eating some healthy food, drinking a lot of liquid, because you need to stay hydrated. most of the thing is staying hydrated, so you don't get especially when you start getting sick, you become dehydrated. That's when you start getting fevers and all, you have to be rushed to the hospital. So stay hydrated. When we're here in America, the many times it's like, can I come over? Can I do this? No, you stay where you are. I stay where I am until everything when settles down and we can visit again. Do as much as you can. Also listen to reputable sources, and also don't go. There's a lot of false information going on WhatsApp and on Facebook. I know people are always saying, I will do my own research. I'll do my own research. Make sure it's a reputable site. Go on the CDC website, go on the WHO website, listen to your local health professionals, listen to the ones like these ladies who they're in charge. Again, make sure you listen to them. Try, break it down to people's level. I'm not saying dumb it down, but to put it to where they understand the message clearly. And I know people are saying don't do the blame game. And I know the word blame has a negative connotation. It's called accountability. Everybody, when they get a job, they tell you this is your job description. If you don't do your job, you get fired. So when somebody say I'm blaming you, I'm telling you, I'm holding you accountable for not doing your job. And I also said Liberia's healthcare is always based on crisis. Between Ebola and now, everybody's like, oh, okay, nothing was done or very little was done to get everything that needed to get done in case. But now we're here, so the best you can. And I'm still waiting for the president's address, by the way. That's one of his role. Comforter in chief and making sure that the country is like safe, and that letting people know that we have this. We're going to try to get this under control as much as possible. Let's all work together, and he needs to get his people to coordinate so you can have better response, so that people can say, yes, I see the president, and he's really serious about this. So let's everybody get together and do it. If you get your faith leaders, everybody get together and do it. The imam, the rabbi, everybody get together and do that. Okay. God can only help you. Help yourself. God will help you when you help yourself.
Thank you. And the president has been a complete disappointment when it comes to the COVID, and let me be the first to say it. He left a voicemail. Again, we need a national address to tell people what to do in terms of crisis. We need leadership. Don't leave a voice message, and say, and then you go into where France has feminists in chief. That's disgusting. The president shouldn't be doing that. And I have to say that because this is crisis. Let the gender minister and maybe your vice president go on that female conference. Nothing against the women, but we have one 1995 in China. You go in and go into Macron. France doesn't have anything. They steal stuff from Africa, and that's what they are using. So we can go crawling to them. We have whatever it takes to make our country better than France. So there's no big deal taking picture with France or Macron. Musu is still here. She said, let's start the fundraiser. Big awareness, on the stigma around taking the vaccine. Liberia people are not taking the vaccines. That's what she's hearing. Rebecca said,
big sister.
let's do a part two. Part two will be very good. People are calling for part two. Let's do it. And most homes, offices, and businesses in Liberia have buckets with pump, soap, and water for you to wash your hands before you enter. We hope you're doing that. These politicians, they used to be carrying buckets around for campaign. They should stop that. Naomi, what's your advice? How do we move forward? And we have 8 minutes to end the broadcast, so let's 2 minutes each. Let's conclude. Naomi,
wash your hands at all times. Make sure you have your small sanitizer on your side, so places that you don't have or hand washing bucket, or you can have the alcohol 50% or 90%. Use it, and make sure to wear long clothes that cover your hands, at least a minimize you touching surfaces. Avoid touching your eyes, your face. Ensure that you have your mask on properly, as Abigail said. And if you are using the reusable mask, don't use it repeatedly without washing it. The same way you dispose the disposable masks, whenever you use the reusable mask, as soon as you get home, consider it dispose into the washing bin or wherever you have your dirty clothes. Wash it, allow it to dry. Usually I even advise people to press it, because when you press it, you help to put a hot steam on it, or when you put on a very hot sun before wearing it again. Ensure that you are using the elastic that is used from behind your ear whenever you are taking it off, when you put it on to take it off. The next thing is that Um, avoid talking to people face to face, coming face to face in contact with people if you have to. Wherever they have restriction and they have buckets, wash your hands. Today, what a seem Struggle Funeral Home were closed because they have more than 50% are past there. I was shocked. We love our loved ones. We don't want to go with them. There's nobody wants. Oh, everybody cry and say, "Oh, I want to go when the person died," but you know in yourself you don't want to go. So we had more than 50% today as struggle. The process that they went through to close it down is something that we can discuss another day. But the idea that we had more than 50%, yes, market is open, school is open, it means that you just follow the instruction. And the next thing is that we need to ensure that we are all calling on our government to lock down. Yes, we can do it. We know there is economic issue. We know that a lot of people live on data per day. The market will be open on the minimum scale. We did a couple of months ago. People didn't die. We need to stop the infection rate. That's key to this virus. Once we can slow down our infection rate, then we can start to go back to our normal way of life. Because at the rate we are going, we don't know where we're going to end up. Because there will be a mandatory we will be compared to lockdown. Nothing going to tell us that we'll reach a point that we will have to lockdown. And we don't want to reach to that point. So let us all consider this important. Wash our hands. Listen to everything everybody is telling you, especially health professionals, the community health volunteers, the community health assistant. Listen to them. The people creating awareness in the community, listen to them so we all can stop the spread of this virus.
Thank you. Tomorrow at 6 o'clock, we're going to have our literary hour with Dr. K. Moses Nawe and Jackie Sayer. We'll be talking about literature, and you don't want to miss it. That's every Friday at 6 o'clock. Today we are, and then on Saturday, we're going to talk a little bit of politics, the progressive movement of Liberia, the activities, accomplishments, successes, and failure. Progressive Ezekiel Pajibo and Wilmot Kuning will be on one side, while Rufus Berry and George P. Lobo will want to find out certain things about the progressive. I will be your guy moderating. We want to thank you so much for coming. I will now turn it back to my co-host, Pastor Patient, to give her advice and also close us.
Well, we keep the awareness going. Make sure you do all the safety, take all the safety precautions that you ought to take. Masking, washing hands, hand sanitizer. The thing here is, yes, that's how you mask up. Make sure your mouth is covered, your nose is covered. And when you're wearing a cloth mask, make sure you wash it. That's right. That is how you wear and, removed. And make sure when you're not washing your hands and you use a hand sanitizer, please, after your third application, please find water and soap and wash your hands. Those of you that are wearing all the mountain looking rings, when you're washing your hands, please turn it around. Yes. Make sure you turn the ring around. Wash your hands for 20 seconds. Wash it in and out. Yes. In, out, up and down. Make sure you do that. And if you notice, yes, and when you wipe it, you rinse your hand down, and when you wipe it, you start from the tips of your finger. When you stop here, because you're not washing all the way down here. So you stop here, and most of the time, this part is not washed. So once the cloth or the napkin touches this place, it means that it's already contaminated. You have to change that thing to wipe the other side. And make sure even the clothes you wear, because COVID is airborne, the clothes you wear when you come from out, especially those crowded places, you need to put that clothes in a separate place. Don't go into your house, we're all discarding that clothes because it is airborne. You never know how you're going to carry it. So we ought to be very conscious about, how we interact with our family when we come from out. Next thing we need to know, most of the time when we are sick, we assume that this is malaria, because malaria will cause an increase in your temperature, 103, 102, and so forth. You need COVID, the same thing. There will be an increase in your temp. take your test, take the COVID test to be sure whether you don't have the COVID, and stop treating yourself at home when you know you don't know whether it's COVID, but you are treating for malaria. By the time it gets serious, you are unable to breathe. You are reaching the stage where you are about to die. When you reach to the place you are out of breath, that's a miracle that is about to take place for you, because you are close to death now. So when those things start early, start attacking it early. Another thing is you will lose your taste. You will lose your smell. If you can smell the next person that been running and playing football, know that something is wrong, especially in a hot place. So when you lose your smell, know that COVID is at your door. Take the test. If you can get the vaccine, get the vaccine. Do everything you can to protect you. You're not only protecting yourself, but you are protecting your family. You are protecting your community, because anyone that have COVID in your home, the rest of your household is at risk. Even now, even with the vaccine, it does not mean you are safe. You are 100% safe. No, you still wear your mask. You still do all the precautionary measures that you have to take. Even us here in the US, I go to work, I wear my mask because I'm interacting with the residents that I have to take care of. I wear my mask, and we do everything that we have to do. You wash your hands, you do all the whole 9 yards. So if we're taking vaccine, we are vaccinated, we're still taking all the precautionary measures. One more for you that is not vaccinated. Stop listening to all the conspiracy theory that is around and all the misconception. Learn to read for yourself and ask the right healthcare practitioner. And to Ministry of Health, please, your website updated regularly. And not only that, it should be accessible. There was a time, I was it last week, I tried to go on that website. It was like freezing. You need to upgrade. In other words, upgrade that website. So anyone want information, they can be able to get that information. So the rest of the country, our president and the government officials, they are pushing 20%. Our president talking about 30-something% out of the country. It should start with you. Start with your 20%. Your entourage should be 20 when you go in. So the people can see you as an example. Have you taken your vaccine, Mr. President? Bring it out in the open. Let people know that it's starting. Our president took the vaccine. Our first lady took the vaccine. We too, we are going to take the vaccine, because they're setting the example, they're setting the pace for everyone. That's a word to all of us. And we'll be here again. Whenever my boss Dennis tell me, I will be here. I'm glad we are all here listening to this awareness. God bless you tonight.
Right.
On that note, I want to say thank you to our panelists, to our guests. We'll gladly want to have you back. I want to thank all those who are watching and those who are going to watch later. Keep it right here on Focus on Liberia, where we educate, we elevate, and promote all things Liberia. Until then, we're going to close with a song that says, "We are all Liberians," because whether you take the vaccine or not, whether you believe COVID is real or not, we are all Liberians, and we must do whatever it takes to make our country that glorious land of liberty. Good night, and God bless you.
Night.
We are Liberia is our